Hello, my name is Dr. Anamika Joshi. I'm an oculoplasty specialist. That means I'm an eye plastic surgeon. I practice in Hyderabad, India, and today I'm going to be talking about the risks of lower eyelid blepharoplasty. Now, blepharoplasty surgery is done for under eye bags or puffy eyes, and it's a surgery in which we either remove the fat, or either we transpose it, or we remove the fat and we graft some fat. This leads to a very good plain look and complete rejuvenation of under eye area with no puffiness visible after surgery. Now, any surgery has some risks, and we can never say about any surgery that it is 100% risk free. So, let us understand the details of blepharoplasty surgery. What are the risks associated with it? Overall, I would say it's a very safe surgery and it gives very good results. But there are some possible risks which you should be aware about before you decide to undergo this surgery. Now, first risk is there could be a little increased swelling or bruising. Now, after surgery, usually 80% swelling goes in 2 weeks and rest 99% swelling goes in 1 month. Sometimes this can take a little longer in some patients, especially the patients who have taken fillers before the surgery. As filler, they block the lymphatic drainage and they can hamper with the recovery post surgery. Therefore, it's advisable that you get your fillers dissolved before you plan this surgery. You get it dissolved 1.5 months before surgery, or based on the amount of filler that you were taken, your doctor would suggest you exactly when to dissolve it. So this is one complication that can be seen, especially in patients who have taken fillers, that there could be some swelling which is not going so easily and could be a little difficult to treat. Second is increased bruising. Now, especially patients who have bleeding tendency, if they have factor deficiency like coagulant factor deficiency, then they could have more bruising than other patients. Now, this is usually we do a clotting examination, the bleeding clotting time, and all the investigations before surgery to make sure that this doesn't happen. But still, increased bruising can be there in some patients. Third complication could be lower eyelid retraction. So when you do blepharoplasty surgery, the lower eyelid may lose a little bit of support, and because of scarring, the lower eyelid can get pulled a little bit down. So this is called lower eyelid retraction. Now earlier we used to make an incision outside on the skin, and that is what used to cause more scarring and could pull the lower eyelid down. However, research has shown that when we do this surgery scarlessly through transconjunctival route, that means we don't put an incision on the skin, rather we put an incision inside. It's completely scarless. So when we use that technique, transconjunctival technique, we don't see the same incidence of lower eyelid retraction, and it becomes extremely less common, I would say, in that technique. However, if you got your blepharoplasty done through skin, then there is a very small chance that your lower eyelid may get a little retracted. So this can be very easily avoided by choosing scarless blepharoplasty or transconjunctival blepharoplasty. Coming to the next complication. Now this complication may sound a little scary, but it's extremely rare, that is vision loss. Now vision loss is an extremely rare complication of blepharoplasty surgery. It is plausible scientifically and theoretically. It will be mentioned in your consent, but it's extremely rare, especially if you are undergoing a blepharoplasty by a surgeon who understands the anatomy of the eye. I would say this is extremely rare. I haven't heard anybody getting vision loss after this surgery, at least in my practice or my colleagues who I know, right? Now, fifth complication could be double vision. Now, this also is extremely rare. So, when you remove fat near here, there is a muscle called as inferior oblique, which is very near the fat bags. So, if a surgeon knows their anatomy well, and then they would definitely not touch that muscle, and so this complication is extremely rare in the hands of a surgeon who understands the anatomy of this region. So double vision is again a very rare complication which will not really occur if you have an experienced good surgeon. So these were some possible complications of lower eyelid blepharoplasty surgery. However, I would say overall this surgery is extremely safe, and it's important for you to discuss all these things in length with your surgeon, who will assess your eyes and tell you specifically for you, are there any particular risks which you should be aware about, right? And once you understand these, you can take an informed decision whether you want to undergo this surgery or not. This surgery usually gives very good results, and patients are usually very happy after this surgery. So I hope this helps, and for more information about this, I regularly keep posting these videos on Instagram where you could go and see more information about the same topic. I hope this helps.